الإعلاميين من وسائل الإعلام المرئي والمسموع والمقروء والإلكتروني. كانتربري بانكستاون لايونز كلاب مجلس 17 تشرين. يسعدني أيضا أن أرحب بأهل البيت الجامعة اللبنانية الثقافية فرع سيدني، وترحيب كبير بوفد الجامعة اللبنانية الثقافية فرع ملبورن الذين تحملوا مشقات السفر وحضروا خصيصا إلى سيدني ليشاركونا في هذا اللقاء. وأهلا وسهلا بالأصدقاء الأعزاء. أيها الحضور الكريم، سيداتي وسادتي، أهلا وسهلا بكم جميعا فردا فردا. تحية خالصة من القلب، وأشكركم باسمي وباسم رئيس المجلس القاري للجامعة اللبنانية الثقافية في العالم لأستراليا ونيوزيلندا الشيخ جو عبيدة، وباسم الهيئة التنفيذية لحضوركم هذا اللقاء ولاهتمامكم في المشاركة في هذه المحاضرة الطبية التوعوية بعنوان اكتشف أسرار القلب، التي سيلقيها الدكتور غسان شربل، طبيب اختصاص أمراض القلب والأوعية الدموية ومؤسس هارت كير انستيتيوت والرئيس السابق لجمعية الأطباء الأستراليين اللبنانيين البام. لذا دعينا إلى لقاء من القلب إلى القلب. حضوركم يسعدنا، ومشاركتكم سوف تساهم في نشر الوعي الصحي مما يؤدي إلى خلق مجتمع سليم ومتوافي. وشكر كبير لسيادة المطران باسيليوس قدسية لأنه استقبلنا بهالسرح الكريم. شكرا جزيلا. جرت العادة أنه تتناول الجامعة اللبنانية الثقافية مواضيع وطنية لبنانية بحتة تتعلق بوطننا الأم لبنان يلي ما بتخلص مشاكله وشجونه، ولكن الجامعة اللبنانية بما أنه اسمها اسم على مسمى الجامعة اللبنانية الثقافية، حبينا أنه نتناول هالمرة مواضيع ثقافية علمية. لذا أخذنا مبادرة فريدة من نوعها بتنظيم محاضرة طبية توعوية إيمانا منا بضرورة الإرشاد والتوعية لما فيه صحة الإنسان وخيره. فالصحة تاج على رؤوس الناس الأصحاء لا يراه إلا المرضى. شاءت الظروف أنه طلب مني أقدم هذه الأمسية الجميلة كمسؤولة الإعلام في الجامعة اللبنانية الثقافية. وشاءت الصدف أيضا أنه الطبيب اللي اختاروه الرئيس والأعضاء مجتمعين لإلقاء المحاضرة يكون الدكتور غسان شربل اللي بيكون خيي العزيز واللي بعتز فيه وبفتخر فيه، واللي كان دائما متميز ومتفوق منذ المقاعد الدراسية. اليوم رح نحكي صحة. ليش صحة؟ لأنه الصحة هي أعظم نعمة للإنسان وما بتتمن بكنوز الدنيا كلها، هي الثروة الحقيقية، ولا شيء بيساوي الصحة والعافية لا المال ولا الجاه. من يملك الصحة يملك الأمل، ومن يملك الأمل يملك كل شيء. وأجمل ما قيل في الصحة مثل بحبه كثير: الصحة حصان، إما أن تنطلق به وإما أن ينطلق بك. من هون أهمية الإنسان يحافظ على صحته. وقع اختيار موضوع المحاضرة الطبية على القلب. ليش القلب؟ لأنه القلب أهم عضو بجسم الإنسان. القلب يلي بحجم كف اليد هو يلي بيضخ الدم لكل أعضاء الجسم، هو يلي بيعمل بدون كلل ولا توقف. طول ما القلب عم ينبض طول ما الإنسان حي يرزق، وبس يوقف القلب بينتهي الإنسان. وتعد أمراض القلب هي السبب الرئيسي الأول للوفيات حول العالم. مين منا ما خسر حدا من عائلته بمرض القلب أو بسكتة قلبية من محبينه؟ ومين منا ما بيعرف هالمقولة المشهورة: درهم وقاية خير من قنطار علاج؟ من هون الضرورة المحافظة على قلب سليم. كيف بدنا نحافظ على صحة قلبنا؟ هون بدنا نسأل الدكتور غسان شربل الموجود معنا تنستفيد من مهنته، من مسيرته المهنية الطويلة والإنسانية. هو اللي قدم قدم مساهمات كبيرة بمجال أمراض القلب من خلال أبحاثه ومنشوراته ورعاية المرضى. رح يشرح لنا اليوم عوامل الخطر المؤدية لأمراض القلب والشرايين والوقاية منها وأهمية إجراء الفحوصات الطبية الدورية. دكتور غسان شربل، المنبر لك، تفضل.
بس بليز دكتور في السيارة بليز YDK level 2M from Mary blocking the driveway here. People need to get out. So please, if it's your car, move it. Thank you. شكرا.
First, I would like to say thanks for the invitation tonight, and big thanks to Sheikh Joe, WLCU, and all the board members who worked very hard to organize the night tonight, to talk tonight. All right.
Please.
When they asked me to present a talk about the heart, I got quite excited because the heart is actually a topic very close to my heart. I find it very interesting. Maybe I'm biased, but I find it to be the most interesting organ in the human body. The heart basically, if there's no heart beating, as my sister mentioned, basically there's nothing else going on in the rest of the human being. Now, preparing the talk, I didn't want to have slides and just text after text and make you bored and fall asleep halfway through the talk. I tried to make it quite interesting. It's going to be interactive, so at any time just ask a question, raise your hand, I'm free to ask questions. If you want me to say anything in Arabic, by all means ask me, I'm happy to translate what I said in Arabic. But of course, not the whole talk. And if you, by the end of the night, if you leave the room remembering one or two things about the heart, I'll be quite happy because that information that you might remember might save your lives or anybody else in your family members. So I hope that you will gain something from it. And also I would like to thank you all for coming tonight. I know it's been a long night, probably some of you haven't been home yet. So thank you all for coming. So I'm gonna start by standard things we do usually when we give presentation about the talk, is a statistic. What actually, sorry, I like to move people. Bit of statistic to start with. Cardiovascular disease comprise heart disease, strokes, and peripheral vascular disease, mean blockage artery in the hearts, the legs, and the rest of the body. So a combination of those three diseases are the world's and Australia's #1 killer. Every 18 minutes, one Australian actually dies from cardiovascular disease. That equates to about 79 deaths every single day. So it's a very big disease. It has a big burden on our health budget as well. Plus, the well-being of people and their family. Over 6% of Australian adults have one or more cardiovascular disease. They could have a combination of heart attacks, heart diseases, stroke, and so on. It's not just one. And that's about 1.2 million people in Australia. So basically, equivalent to 1 in every 20 Australian is affected somehow by that disease. In 2020, about 57 people in Australia aged 25 and over, and I emphasize 25 and over because we have seen lots of young people having heart diseases, have had heart attack at some stage or unstable angina. Unstable angina, like it's people developing disease that will lead to heart attack down the track, which is around 155 every single day, and 12% of those people actually they will die by the end of the day. And the number of people suffering those diseases are increasing every year, and that's due to the changes in our lifestyle, especially obesity and diabetes, which are the major risk factors for cardiovascular disease. Now let's go down to business. Heart diseases. It's not just heart attack. It's a group of variety of diseases that can happen to male, female, old, young, newborn even. But I won't be talking about everything because I'll be spending days and days talking about it. So I will try to be as brief and as common knowledge to everybody so you remember. Heart attack, I will be talking about a bit more in details because that was most likely the more important topic of the night. But there are other heart diseases, not just heart attack. Angina. Angina means people are developing blockage in their arteries of their heart, but not bad enough to cause heart attack. But people with angina, they will be developing symptoms such as short of breath when going uphill activities, doing exercises, or any kind of movement that develop angina. And those people need to be looked after very carefully because that will lead to a heart attack down the track. Heart failure. Heart failure basically is like in Arabic, تضخم بالقلب. So basically the heart can be enlarged and quite weak. So rather than normal heart pumping like that, the heart failure heart pump like that. And some patient actually, when I look at the test that we're doing for them in my rooms, I look at the test, I look at the patient, is he breathing, is he not breathing? Because the heart is barely moving. And that's what heart failure is. And heart failure is going to be quite big burden on the health system because those people present to the hospital quite frequently and they usually have very short prognosis. They're usually dead by 3 to 5 years unless they are treated very well with the right medications. And with the heart disease, it can be many reasons. It can be blocked arteries, like heart attack leading to heart failure, or it can be just a virus. Some people have just chest infection. The virus attack their heart muscle, and it makes it quite weak. And then usually we have to put them on specific medications and keep watching them to make sure they get better. And the worst case scenario of heart failure, especially in young people, they end up needing heart transplant. Now with valvular disease, it's basically this anatomy inside the heart. It's in, are these, that's all correct, sorry. Yeah. So basically, sorry, I don't have the pointer. So these are the valves inside the heart. These are the chamber where they pump the blood in and out of the heart. And it's not just, as I said, heart attack or heart failure. People sometimes come with valvular disease. It can be either blockage or calcified valve, quite tight, so the blood is struggling to get out of the heart or going inside the heart. Or it can be leakage valve. Some people like a murmur or sumam عم بيروح. That's what that means, leakage valve. That means rather than all the blood's going in one way and the valve closes, actually there's a big gap between the leaflets of the valve and the blood comes back. So, and that becomes quite severe. Patients becomes quite sick from it, short of breath, chest pain, and they need to be either repaired or have surgery. Or if they are too frail to have any intervention, unfortunately they will end up dying. Now, arrhythmias, if you compare to the heart attack is like the plumbing of the heart. Arrhythmia is the electricity of the heart. Arrhythmias are basically how the heart pump and how the rhythm of the heart. And the normal simple heart rhythm, can show the next one please. That's the top one, that's a normal ECG. What we just put some dots, usually when you go to the hospital, and then we do that. And then we class lots of information. That ECG we don't want to see. It gives us very, very anxious time. No. Sorry, this one. Yeah. That ECG, if patient stays in that rhythm for a long time, they drop dead. Very simple. And then people with heart failure are at high increase of this kind of rhythm. And then when we do the ultrasound on the heart failure patients, we look at the pumping capacity. The normal capacity is about 55% and above. That's considered normal. When that pumping capacity drops below 30%, people are at high risk of developing arrhythmias such as that. So those people will require a defibrillator. Because defibrillator is like a pacemaker, but has electricity in it. It basically sit there and watch. One rhythm like this happen, the patient might actually collapse and die. What does the defibrillator do? Before the patient actually dies, it will shock them and then bring them back to normal life. I'm going to show an interesting video. The next one, sorry. Don't play yet. Sorry. So that's this professional soccer player. He has problem with his heart, and he has a bit of heart failure. So this guy, they had to put defibrillator because it's at high rhythm, at a high risk of developing that dangerous rhythm that we see. So basically, we don't know when this rhythm is going to happen. It can happen in 1 day, 10 years, 20 years, but we don't want to take the risk of this happening without protection because if it happens, the patient will die. Now, if you watch the soccer player, he has that defibrillator inserted. And then you will see him actually is walking, he will fall, and then you see his legs shaking. That's because the defibrillator has actually kicked and shocked him and brought him back to life. Can you explain that, please? From the beginning. Try that. Sorry, just start from the beginning. So that's the player touch. So basically, he did that if it wasn't, and then you see his legs are shaking. That's a different bet that actually had shocked him. And look, and he just set up now. But nothing has happened. And he wants to play again, but that took him out of the field, of course. So, if it wasn't for that defibrillator, basically the person would have been dead by now. So this defibrillator is quite important, and that's what we look at, although arrhythmia is the funny rhythm and the heart failure. Now, also we have what's called congenital heart disease. It means people are born with this kind of diseases, either inherited from their family or there are something lifestyle changes happen that when they were born, it caused the problem. The first one is quite common. That's called the aortic valve, the main valve that heart pumps the blood through that valve to the rest of the body. That's the normal heart valve. It has like the Mercedes sign. The congenital one, when they come, two leaflets. So just straight line. And we see lots of young people, their 20s and 30s coming to my room with this kind of valve. And actually, I had a patient, he's only 42, he's very fit, athletics, he runs 15, 20 kilometers every week. One day, he woke up at night with palpitations. And then he went to bed. His wife was concerned. Go see Dr. Charbel, because I look after her father. And then he said, okay, I'll go. He kept delaying the thing, and one day he came to see me, and he was completely fit, healthy, no symptoms whatsoever. I did ultrasound on him, and he had that valve with significant regurgitation, significant leakage valve. So basically, within 2 weeks, ended up having surgery, and he replaced that valve. Lucky that he came, because at the moment, maybe because he's quite fit, maybe that's why he wasn't getting much symptoms. But if he kept going, definitely his heart becomes quite big, because the heart have to compensate with this overload of keep pushing too much blood through that valve, and he developed heart failure. So lucky he came, we fixed him before any damage done to the heart. So you don't have to be just old to have heart problem. You can be as young as 20, 30, even 15, or even newborn these days with congenital. But being an adult cardiologist, we only look after patients 16 years and over. Good. And also, there are different types of valves. There are the walls between the heart chambers can have a hole between them, so blood can go from one chamber to another, rather than that being closed and going in one area. The bottom chamber of the heart can have holes in them, and that's a normal artery that can be swamped, and this needs surgery usually at a younger age. So lots of diseases, and usually happen, that's for the young people. And some of those diseases, like that valve, that runs in the family, so when the patients come to us with that kind of valve, we tell them that his kids, the brothers, sisters, and their kids need to be screened for it, because there's a good chance they might have it as well. Go back on the slide, sorry. One more. Okay, now also there's a stress-induced heart attack, which is a broken heart, we call it. That's usually happen if someone's cat died suddenly, some like big death in the family, or like a big major event happened in their lives. They present to the hospital with the typical heart attack symptoms: chest pain, short of breath, blood test for the heart's quite high. But when you do the angiogram, actually the arteries are pretty clean. There's nothing going on. But the ultrasound showed that the main chamber of the heart is ballooning, and that's usually because of the stress. These people have good prognosis because we put them on medications for the heart, and then within a few months back to normal. But it is actually a disease, and it's actually well known now, called broken heart. Next one. Okay, now let's go down to business. What is a heart attack? There's a difference between heart attack and cardiac arrest. To start with, cardiac arrest is actually when the heart arrests, stops beating, so stops. Like this guy who fell on the ground, that's called cardiac arrest. Heart attack is the heart still beating, but there's not getting enough blood supply to an area of the heart where the artery supplies to the heart. And then usually it's, as I said, the plumbing of the heart, so all those vessels. Now the heart is a bag of muscle, pumps blood to every organ of the body. But the heart itself needs blood supply as well to survive, otherwise they'll die. So they have their own blood supply through those arteries. That's on the right, and that's the middle one. Probably you heard the word widowmaker. That is the widowmaker artery. So that blocks, there's a high chance people can have arrhythmias, like I showed you before, and patient actually can drop from that. So an area of that artery blocked, not enough blood coming to a certain area, and people will develop symptoms. We'll talk about symptoms shortly. And that's because the lack of oxygen getting to that area of the heart. And the longer we ignore the symptoms, if somebody is having a heart attack, the worse the prognosis and the more complications, because the heart cells will start to die and become irreversible. The sooner we can deal with it, the sooner actually can the cell revive again and survive. So basically that's an area of the heart not getting enough blood supply. You could see it's getting on the dark because it's not getting enough oxygen. And that's the arteries of the heart when actually a heart attack occurs. That, to start with, is the plaque. That's what we call stenosis or blocked artery. Can be 30%, 40%, 50%. Now, when the heart attack occurs, that blockage, say like 50%, for example, suddenly becomes 100%. Not slowly develop 50, 60, 70, 80. That's called angina. Heart attack is one small blockage, become 100% all of a sudden. And usually that occurs because if you could see that cap around that's cholesterol deposit, and that's a cap. That's why sometimes we put patients on cholesterol tablet because the cholesterol tablet can stabilize that plaque. When that plaque becomes vulnerable and ruptures, clot, because blood coming through the arteries, a clot can form because it will expose the cholesterol, and cholesterol is a foreign body. So when that is exposed to the artery, clot can form suddenly, 100% blockage, heart attack. And then if not treated urgently, as I mentioned, become this area wherever the artery is supplying, it can die actually and can cause problems. It's that vessel to this area. So each vessel has different part of the heart, supplying different part of the heart. Now, symptoms of heart attack. These are textbook description. Pain or pressure in the chest, or as we know, blata acidri. Pain or discomfort in the arms, mostly on the left side, and go up to the jaw or goes to the back. People develop shortness of breath because the heart is not pumping very well, not sending blood to the area and oxygen, become quite short of breath. Also, if the heart attack is bad enough, can cause a bit of fluid on the lungs. You can become nauseous, you can be quite fatigued, feel tired, dizzy or lightheaded, and you can be sweaty with the pain. Depending how severe the heart attack is, the worse the symptoms. Now, having said that, not all heart attacks are the same. I had patients having heart pain on part of the elbow here, and actually it was a heart attack. I had patients coming to me with the test, actually they had heart attack in the past, but they never knew about it. That's because, especially those people have diabetes, because people with diabetes, that cause damage to their nerve ending, and then because of this, they don't feel the pain. Doesn't mean they didn't have the pain. They had something, but they couldn't feel it because they cannot feel pain because of the nerve ending. So heart attack can be in any shape or form, basically. So if at any stage you have symptoms that you are concerned, at least go to your family doctor if you don't want to go to the hospital or call the ambulance. Just go to the doctor because the doctor can do at least an ECG to start with, and then he will say, look, that's fine, go to see the doctor at some stage, or not go to the hospital. So next one. And as I said, the warning signs differ from person to person. People can have like a bit of discomfort in the throat that can be a heart attack. And people who develop heart attack are at increased risk of having another one because they're already at high risk of developing one heart attack. They're at high risk of developing another one because they usually have lots of risk factors leading to that, which we'll talk about that shortly. Now, our main talk of the night is the heart attack and how to recognize it, what to do about it, how to treat it in a way, and how to prevent it is the most important thing. The main part of my job is preventative cardiology, is try to look after patients, try to treat their risk factors, and hopefully prevent them from having heart attack, rather than having heart attack and then they come to me and see them. Of course, I see those patients, but so better prevent it from happening and then treat it. Now, what to do? The most important thing is just don't panic and try to recognize that something is going on, especially if you don't feel comfortable, even though you're 30, 40, 50 years of age. Never say, no, I'm not going to have a heart attack. It's not going to happen to me. I'm not going to be the one, because it doesn't discriminate. No matter you are woman, man, black, white, any race, and some races actually have more risk of developing heart disease than others, like Indian, Pacific Islands, and so on, are more risk of developing heart diseases. So the most important is just to stop whatever you're doing, because if you put more strain on yourself by continuing exercising, you are making things worse. So try to stop. Tell somebody that you're not feeling the best, and the most important thing is to call triple O. As I said, heart attacks are an emergency, basically, because every minute counts. Every minute you delay the treatment, the more heart cells will die. The more heart cells will die, the more of your chance of having heart failure. And now they recognize it for the last few years. If somebody's having a heart attack and the ambulance comes and they do an ECG, no, sorry, that's fine, that's okay. And they do an ECG and that confirms that having an acute heart attack. In the past, we used to take them to emergency, do the ECG blood test, call the cardiologist, get the cath lab organized and so on, and get them to cath lab. Now what we are doing at the moment, if the ambulance comes, somebody's having a heart attack on the spot, with the ECG by the ambulance officers, they will contact the closest hospital that they do have a cath lab. They contact the cardiologist directly, they bypass emergency. The patients go straight from the ambulance to the cath lab. And while in the cath lab, the cardiologist would have been notified on the way, so he'll be there, the nurse is there, and everybody will be waiting for them, and they will do an angiogram and try to salvage the heart muscle from dying. So that, by saving good 20, 25 minutes, have been saving lots of lives. So now they go straight to the cath lab. Any questions so far? Good. Yes?
Hi, I just wanted to ask, the symptoms you mentioned for the heart attacks, how long should they start before the heart attack may occur?
Usually, as I said, because the heart attack happens suddenly. So when that blockage, the clots form suddenly, that's when people have symptoms.
So it's most of the time the big
Straight away, especially when it's a big heart attack. Now, you see people having like angina or the blockage, but not bad enough. So when at rest, they have no symptoms. But when they start to walk, go uphill, stairs, do some activities, they need to put more strain on the heart. And they need more oxygen. And because a blockage is like 80%, for example, they develop symptoms. They rest, symptoms get better. So these people have angina, but the heart attack acute like this, as soon as it happens, people will develop symptoms straight away. And as I said, could be short of breath, could be sweaty, dizzy. Doesn't have to be chest pain in particular, but that's one of the main symptoms. Yeah. Okay. Now, while waiting for the ambulance, because it might take 5-10 minutes for the ambulance to come, you could do a few things actually to save lives. If you are the person or somebody actually that you know. The first thing is to chew aspirin, because aspirin is a blood thinner and can get a bit more blood flow through that. Because sometimes the blood clot causing the blockage, it's not 100%, could be 99, 95 or something like that. So by chewing aspirin, you make things a bit more, the blood more thinner, and hopefully a bit more blood flowing to that area of the heart that's affected. And that actually can save lives. But of course, if you're allergic to it, don't take it. Now, people who have angina or have issues in the past, like heart attack or heart problems, they have the nitroglycerin, like the tablet under the tongue, we call it in English, حبة تحت اللسان. So if you have that or the spray, you take it, because that actually allow more blood flow to the heart. So that all will buy time, will save heart cells from dying until the ambulance people arrive. Now, if somebody is unconscious, start CPR. You go in the chest, hopefully you guys know your first aid. If not, it will be worthwhile doing one course, because actually you can save lives. So you do CPR, go to the chest, and you compress. You compress as hard as you can. Doesn't matter if you break ribs. Breaking ribs is not going to cause a problem, but if patient's not being CPR properly, actually they can die. Because you need that pressure to push on the heart to get the blood flow to the brain, oxygen, and so on. So push as hard as you can. Doesn't matter if you hear crack, that's the ribs broken, doesn't matter. Patient can survive that, not a problem. So go as hard as you can. And if there are places like shopping centers, gyms, whatever, you see those defibrillators. I don't know if you have one. Did we provide that? No. Actually, Alma provided defibrillators for most of the religions, to the Maronite, Catholic, Orthodox, everybody. We provided one for them to save lives. So if they're around, very easy. Just open it, put a pad here, pad at the back, turn it on, and usually it will work for you. It will see if there's rhythm like that soccer player or that rhythm I've shown you. It will give shock straight away and bring patients back to life. Okay, now how is it diagnosed? As I said, the ECG. I don't know if you remember the first one. Usually that line is meant to be straight with this line. You see how it's gone up big time. That is typical heart attack. And that's when the ambulance arrive and they do ECG on a patient or GP or whatever, and they see this line, that's acute heart attack. They start full treatment, aspirin loading, they call the cardiologist, the cath lab, and they take patients straight to the hospital. It can be diagnosed by a blood test, because sometimes it's not very typical of heart attack, can be this or the other. We do a blood test called troponin, and it's a muscle, it's an enzyme released by the cardiac muscle. So if there's a heart attack, that muscle that's affected will release the enzyme. It will be quite high in the blood. Chest X-ray is another investigation. Usually people develop fluid in the lung, like back pressure. And the ideal test will be, as I said, the coronary catheterization or angiogram, people know, بالعربي التنميل. They'll go to the heart, they'll see where the blocked artery is. It's usually done, used to be from the groin, now they go from the wrist. It's not a surgery, I'll tell my patient, it's a procedure. Because you'll be awake, they just numb the wrist with a local anesthetic, and then they put a small tube in your artery. And while you're watching, the bed and x-ray around you, basically. So once that's numb, tube goes to the heart, and they will give you contrast, like a dye or a mlawani. They give you that, and they look at all those three arteries I showed you first, and they see which one is blocked. If any blockage above 70%, then they take the tube out, another special tube, they put a balloon, I think, here, the next one please. So they put catheter through the blocked artery, they inflate like a balloon to crush that blockage open, and then they leave the stent and they put back. That stent stays there, it gets covered by the blood vessel lining down the track, so that will stay for long term, forever basically. And that's called like a chicken wire. It stays there to keep the vessel quite open. And those people need to be on special medications like 2 blood thinnings for a year, and then we cut back to 1. But that's, by doing that, blood flow back to normal. And if it's treated sooner than later, blood will go, oxygen will go back to that dead or dying muscle, and actually might survive again. Now, as I said, one of the tests available to find the risk factors, sorry, go back. One more. Okay. Now, what tests are available at the moment to detect heart disease? There are lots of tests, but these are the most common kind of day-to-day we use. ECG, as I mentioned earlier, it will tell us if patient having heart attack or even angina, because that line going high, and angina it will be actually going below. Also, it will tell us if there's a funny rhythm for the patient, the soccer player, or it can be different type of palpitations. I've seen lots of patients coming to my room with palpitations, and that can be another big topic actually. I'll talk briefly about that because it's quite important. Now, palpitations basically means heart is going very fast, not strong, because lots of people confuse between strong and fast. That's strong, that's fast, and that makes big difference, because that is palpitations going fast. And the reason for that can be many different reasons, but the first thing usually I tell patients, cut back on your caffeine. Coffee, black tea, green tea, cola, Pepsi, chocolate, and energy drinks. So if you do get palpitations, first thing you do, cut back on your caffeine and take magnesium supplement. Magnesium is a vitamin. It's not done in prescription, and it's quite useful for cramps and for the palpitations. But if the palpitation become more often and can cause you symptoms, then we need to see what kind of palpitation is it, because it can be treated. There are different types of palpitations. Some can be benign, very common in young people, and some can be dangerous because it can lead to clot forming in the heart, going to brain, causing stroke. And those people need to be on very strong blood thinning medication, warfarin or those new oral tablets these days. So palpitation is quite important to find out what kind of palpitation is it and how to treat it. We have exercise stress tests. I'm sure some of you have been to my office, and we put them on stress test. So basically, we try to put the heart under stress, and then we combine it with the ultrasound. We'll see how the heart pumping at rest and pumping very fast. And we try to compare if when pumping at fast, all the walls are moving in symmetrically or one moving more than the other. These are signs that something is going on, and those people need to be referred to have an angiogram. The echocardiogram, it's like, that's stress test. The next one. And the echo, basically, it's just an ultrasound for the heart. That will tell us lots of information. If the patient has heart failure, look at the valve, there's a leakage valve, calcified valves, fluid around the heart. We've seen lots of patients after the COVID vaccine and the COVID infection coming to my rooms with the chest pain. And the word they could have called pericarditis, which is inflammation of the sac of the heart, and then sometimes can be due because of fluids around the heart. So that can be picked up on the ultrasound. Now the CT coronary, just go back again, sorry. This test is very popular, and lots of people have heard about it. Sorry. One more? No, back. Sorry, okay. There's a CT coronary angiogram. I'm sure lots of you have heard of that test. And we do it actually on lots of occasions. That kind of between stress test and the coronary angiogram. So what that test is a CT scan, and they'll give you the dye, the contrast. And then what they'll do, they'll look at all the arteries of the heart, and that give us an idea if there's a blocked artery. Now lots of people coming to me saying, I can have that test. Usually we don't do it because it has its limitations as well. It's not the best test. If you're under 40 years of age, it's not really accurate. If lots of calcification becomes over representing blockage, so it could say you have significant blockage while you don't, but sometimes could be quite useful. So we do send people for that. But also some people who have allergy contrast, like the iodine contrast, it's not good for them. And the MRI to look more for structural thing. Okay, next one. Okay, now, I'll go back, sorry. Okay. Probably you've seen it, go one more. Okay, now, we talked about heart attack, what heart attack is, what to do when you have it, what the symptoms that to alert you to that could be a heart attack, and what we do about it. Now, what are the risk factors of leading to a heart attack? Probably you've seen some of them already. Anybody?
Smoking.
Blood pressure.
Drinking.
Smoking. Let's start with smoking. It's my favorite subject. When a patient comes to me, I ask them, do you smoke? And they say yes. I say, well done. Because if I tell them to stop, they won't stop. Then well done, and they start laughing. They get the message. Now, I'm sure lots of you have heard about the argile. Does anybody know the argile, how many cigarettes?
60.
200. Learned very well. Each argile is equivalent to 200 cigarettes. So I tell people actually smokes, don't argile. That's right. So, because the problem you have the argile and you have nothing to stay, but for fun. Actually, it's quite damaging. So if one thing you learn today when you go home, stop the argile, I've done my job. Look, you don't have to stop straight away, but if you actually cut back, not having argile every day or rasen, whatever they call it, have it like maybe once every week, only few measure whatever, and then try to stop it. Vaping. What is better, vaping or smoking?
Smoking.
Vaping, that's right. People who are vaping, I tell them smokes, don't vape. Exactly. Because it's much worse actually. And very addictive. Very addictive. And lots of young people actually now are addicted to vaping. I've seen so many young people actually intensive care because of vaping, 17, 18, 19, because of vaping. Actually, it's quite bad because you don't know what's in it. Actually, the cigarettes, you know, it has tobacco, it's deadly, you know it. But it's not that deadly, not quickly as vape, because you don't know what's in the vaping. Because all the flavors now, they hook all the young people. And if you look into the companies actually owns the big vaping companies, like Philip Morris, the smoking people. So they know that vaping is the next trend now because people cutting back on cigarettes are vaping and they're targeting the young people. You can see now 15, 16, 17 smoking, vaping. School now they try to detect people, students who are vaping, try to stop them because it's very addictive and can be quite deadly. Vaping started to encourage people to quit smoking, but the problem is that people quit smoking and they become addicted to vape. So I tell them, stop the vaping. It's quite bad. Well, ideally don't go at all, but if you have to, I prefer go smoking than cut smoking. And what I also tell my patient who smokes, basically, you will not stop smoking unless you want to stop smoking. I can speak to you for hours and days to stop smoking, you won't stop smoking. And I know it's not easy. I tell them it's not easy because I think, okay, the doctor let me stop smoking, I'm going to stop. It's not easy, I know it. But at least the first step is for you to start thinking that you want to stop smoking. That's the big step. And then from there you can either see the GP to give you like treatment to help you quitting, or go cold turkey, or just cut back slowly and stop. Any way you do it, or acupuncture, or yoga, any way you do it, as long as you stop smoking, you're doing yourself a big favor. And later on I will show you the risk factors of somebody who smokes compared to somebody who doesn't smoke. How you'll be amazed. Now, smoking, somebody mentioned blood pressure. Okay. Blood pressure. We'll get to that. The blood pressure is another, actually, let's go to cholesterol because that's one on my list. Okay. High cholesterol. Now, unfortunately, with our diet, lots of people have high cholesterol. Some people, even without having bad diet, they do have it, and that's called familial hypercholesterolemia. It means they have high cholesterol regardless because they run in the family. And those people usually will get, their cholesterol will be like 8, 9, or 10. Now, normal people don't have familial hypercholesterolemia. It's all mostly because of diet, lack of exercise, and our bad lifestyle. In the old days, when you used to turn on TV, you have to get up. Press on the button on TV. If you change channel, you have to get up. Now you sit down on your phone, you check your mail, you do business, you remote control your TV, everything. So you have to even move the couch. And lots of people actually doing that. Plus our diet, everyone's working long hours. Now working from home. All they do, open the fridge, eat, come back, eating all day. And they don't eat the right food because one patient asked me, what is the good food for me? How can I know which food is good or bad? And I said to them, if it tastes good, it's bad for you. That's the bottom line, because it has sugar, salt, fat. Okay? So, but anything in moderation actually is useful. So if you eat fat, as long as you don't have lots of it, it's good. But you have also combined it with exercise. So with the cholesterol, try to avoid too much like dairy products, jibne, lebne, all this stuff. Have the low fat if you can. Eggs are good for you if you don't have cholesterol. It's good for the heart. But if you have cholesterol, the yellow part of the eggs are actually the cholesterol part. So have 2 or 3 a week. Cut back on the sweet, on the fried stuff. Try to grill most of the food. And exercise. And try to avoid eating out because any food takeaway is actually bad food. That's what tastes good. Because, for example, McDonald's, Big Mac, the bun has fat in it. We were overseas recently, everything has sugar. Even the bread has sugar and everything has sugar. So anything you eat from home, you take to work from home, is better than eating out. And now with these days, with the cholesterol, there are lots of treatment. We start with medications, and people who have a heart attack, usually we have to go very aggressive with their cholesterol control. Their bad cholesterol, we call it, has to be less than 1.6. And there are limits to how much we go high on the medications, or some people have side effects of the medications, like muscle pain. For the last couple of years or so now, we have injection, actually taken twice a week. So that came in the market, actually, the bad cholesterol has dropped quite significantly. Next one. Okay, somebody mentioned blood pressure. Blood pressure is another risk factor for heart disease. Now, if you have no diabetes and no heart issues or stroke, the cutoff mark is about 140 or 90. Ideally just below that, like 135 over 85. Or in Arabic, 14 على 9. The way you convert it, just divide it by 10 or take a zero off. So 150, 15, 140, 14. So the maximum should not be more than 140 or 90. If you have diabetes, that drops to, and that can be, lots of people can walk around without knowing that they have high blood pressure. So it's good every now and then, if you don't have blood pressure machine and you don't want to go to your GP, just a local chemist. Get them, sit down for 10 minutes first, get them to check the blood pressure. Also what I noticed lately is some people like they have stress in their lives, they go to GP, they check their blood pressure, it's high. They start on a treatment. I do not agree with that. I'm not type of doctor that I like to give medications to my patients unless they really have to. So usually those, when you do have blood pressure now first time, try with the lifestyle first. Salt is your number one enemy, okay? So a bit of salt in the cooking, that's fine. Don't put table salt, bzurat, get the unsalted raw stuff, halloumi, it's pure salt, processed meat, salami, pastrami, pizza, everything have high salt in them. So if you do have blood pressure, watch your salt intake. It's very important. The less salt, the better. Also, lots of people have what's called the white coat syndrome, white coat for the doctor. So they do not have blood pressure, but once they're at the doctor practice, blood pressure is very high. Outside is normal, so blood pressure. So usually what we do, we put blood pressure machine on there for 24 hours. It's checked every 20 minutes, and then we'll see what's going on. I had a patient coming, it's only 22, came to me, blood pressure 190 when I checked it. So it doesn't sound right. So I put the blood pressure machine, actually it's 110 most of the time. So this patient, for example, if went to the GP, checked the blood pressure, they put him on medication, put him on medications, and would have made it worse because his blood pressure is low. And if you put him on medication, it would be even lower, cause more problem. And plus, saving him being on medications and side effect. So it's good to always try a bit of lifestyle, unless being high on multiple occasions, then it's definitely high. And so with the blood pressure, that's okay. With the blood pressure, also overweight can lead to blood pressure. Rule of thumb, basically, if you lose 10% of your weight, so let's say you're 100 kilograms, you go down to 90 kilograms, blood pressure will drop by about 8 points. So sometimes if you borderline high, like 145, you lose some weight, actually that can go back to normal. So by losing a bit of weight, you can save yourself from being on medications. So weight can lead to blood pressure, plus alcohol can lead to blood pressure, too much coffee can lead to blood pressure, and also sleep apnea. I'm not sure how many people know of sleep apnea. I diagnose lots of patients with sleep apnea, which is not my specialty, but it can lead to blood pressure, palpitations, and can lead to heart issues. Sleep apnea is basically people when they're sleeping, they are snoring, but not all snorers have sleep apnea. So you snore, and then you stop breathing. So usually I'll ask the partner, I don't ask the patient, and then usually always arguing, because I ask her, does he snore? She says yes heavily. No, I don't snore. No, yes, you snore, you don't snore. So they're usually arguing. So that's why I ask the patient, because they never know. Ask the partner, does he or she snore? And they say, yes, they snore a lot. It's like relief to them telling somebody, yes, they snore a lot. And then he looks at it like, okay. But as I said, they have to snore and stop breathing, like, and then basically they're dead for like 30 seconds. Or these are signs that patient have sleep apnea. What it is, you lie down, you snore, and actually you block your airways. So actually no oxygen going to your lungs at all. Oxygen saturation drops. 95% being normal, it goes down to 70. If you don't breathe, you will die. So basically, the brain wakes up and start breathe again. Some people can have that 20, 30 times an hour. So basically, it's like every 2 minutes you are waking up. Your eyes are closed, but your brain is waking up and sleeping, waking up, sleeping. And that's why those people actually, they feel sleepy the next day because they haven't slept at night. Although they say, yeah, but I sleep 5, 6 hours. You are sleeping and your eyes are closed, but your brain is waking up 600 times. And those people need to see the GP to be there. They put some dots on their brain and all that, and they check the oxygen. And then the treatment of that, either losing loss of weight or having the mask at night. And also, if you have sleep apnea and is not treated, you have about 25% more chance than somebody else to have car accidents, because you can have quick naps whilst driving. So it's quite serious, and that can lead to blood pressure as well. That's why I mentioned that. Now diabetes. Diabetes is another major issue, basically, and killer in lots of patients. Can lead to stroke, kidney damage, eye blindness, leg supply, like artery supply to the blood supply to the legs. People can get their legs cut, and increase the risk of heart attacks. Again, lifestyle is very important. Carbs is number one enemy for diabetes. Bread, rice, pizza, pasta, potatoes, نعيش ناكل عجين. Chocolate is not good for the cholesterol, but it's good for
the bread or what you eat in the bread?
the bread, the carbs.
Itself?
Bread itself, yes.
Because usually we eat the bread with something else.
But something aside can be healthy. But the bread itself, the carbs, like rice, كل شيء معجنات, نشويات. Look, the less the better. Okay? Better, but it's still not it's still better than probably normal bread. But it's not, as I said, our diet, we have to have bread and most of the stuff. But rather, for example, have mjadra بالخبز, have it with salad, for example. You know, that's one way around it. Okay?
Doctor, you've got a question here. Sage bread.
Size is a bit better. Size and whole meat, but still. Thin. As I said, everything in moderation. If you eat a lot of it, cut back, it will get better. And also, by cutting back on the carbs, you lose lots of weight. So if you eat lots of carbs and you stop it or reduce it significantly, you could lose 5-6 kilos within a couple of months. So it's very easy things to do. And as I said, nothing comes easy. You want good lifestyle, good health, you have to sacrifice it. And we talked about smoking. Next one. And lack of physical activity. As I said, we sit down on a couch, our phone, remote control, and we do everything without even moving. And lots of jobs are basically on the desk. So any activities is better than nothing. 30 minutes every day is pretty good. Even 20 minutes is better than nothing. And try to have a bit of power walk. You need to get that heart pumping bit fast. You know, if you walk in Gandar, don't want doing it. Or you go for a walk, تعبي جابتك بزورات or something, وبتلاقي شيء كويس. Like what's the point? So try to keep this. Don't do good thing in one hand and then take it from the other hand. So try to walk a bit fast, get the heart pumping. And I said 30 minutes you can take the dog, you go with your partner. Quick power walk, 20 minutes, 25 minutes. If you do it every week, every day, 5 times a week is better than nothing. And if you want to go to buy something from the shop, it's like 5-10 minutes walk. Don't get the car, just go for a walk.
Let's go Uber.
Sorry?
Go Uber.
Uber, that's right. But make sure stop the Uber like a few steps, like a few streets down, and then try to walk to Uber. Next one. Okay, now family history of ischemic heart disease. That's actually is a risk factor for developing heart diseases like heart attacks and so on. Unfortunately, nothing much you could do about that. You cannot change your family. You're too late. You start with them. But it tells you something. Like I had a patient today, actually, he's 42. He had a heart attack 2 years ago. His father had a heart attack and died age 50. His 2 uncles died of heart attacks age 50 and 145. His sister had stent already put in his 50s, and he still smokes. So my name is Dr. Charbel. I'm not Mar Charbel. I can't do miracles. I can help you. I can help you. I can help you with the medications. We can help to control the cholesterol. We can help you control the cholesterol, get the blood pressure down, look at the things. Family can change. It's too late, but you have to stop smoking. Otherwise, you're going to have a heart attack. I know this guy's not going to live for too long because he's going to have another heart attack. No matter what I do, he's going to have another one.
This steep the blood now.
Sorry?
This steep the blood.
So, look, some people actually do listen to me and they stop smoking, believe it or not. But some people say, look, I don't want to stop, but they move, بيع 90 سنة عم بدخن ومدري شو. But I tell him, when your grandfather lived to the 90, he was living probably on a farm, working 24 hours a day, and then eating healthier, not like you're sitting behind the desk like all day, eating Big Mac, chips, and all this stuff. So it's a different lifestyle as well. And as I mentioned, like poor diet, high in fat, high in salt. So try to keep, in general, your diet low in sugar, low salt, And try to get used to the unsalted food, just a habit. Even though I like my salt, but actually if you cut down slowly, it becomes like a habit and won't affect you. And of course, high in fat. And old age. Now, actually, next one please. And as you grow older, of course, risk factor goes higher. Okay, so that's actually a very interesting chart, and I think that's
You missed very good,
Old-
important one.
old age.
No.
Which one?
Stress.
Stress. Look, stress will not cause a heart attack, but it can cause the other one I mentioned, that the broken heart, but that's not long term. If you have established problem in your heart, stress can make it worse. Okay? Stress by itself is not gonna block your artery, but stress can lead to high blood pressure probably, and then stress maybe indirectly can lead to bad eating habit, exercise, eat junk food, don't exercise. So indirectly it can lead to it, but not directly. Now that chart should convince people who smokes to stop smoking. If it doesn't, I don't know where else to go. Now let's just take an example, kind of standard case. Somebody in their 50 and 64, let's take men just to simplify things. I'll show you people without diabetes who smokes and people with diabetes who smoke and don't smoke, and you can see the difference. Now that chart, actually, you can check it yourself. You can go to the, I think, Heart Foundation website, look at your cardiovascular chart, and you can see where you fit in that chart. Are you at low risk, moderate risk, or high risk? What does that usually is? It's 2% per year. So if your risk is in 5 years 10% and above, you're at high risk. If you're below 10% in 5 years, you're at low risk. So between less than 5, very, very low, 5 to 9, still in low risk, 10 to 15, moderate, and then comes very high after that. And that's usually percent of risk of developing cardiovascular disease within 5 years. Let's give you an example, then you know what I'm talking about. Let's say somebody in their 50s and 60s who have cholesterol of 6, high cholesterol, okay? And then blood pressure is 120, good blood pressure. They're not diabetic, they're not smoker, just middle-aged man in a way, and cholesterol high. So that's non-smoker, that age, and 120. It's great. That's 5 to 9, that's low risk. Being a smoker, cholesterol 6, blood pressure 120, same age, 60 to 90. From being low risk to being high risk, we haven't changed anything. Same blood pressure, same cholesterol, same age, same family history, same everything. By being a smoker, we're going from low risk to very high risk automatically. So that's why smoking is very important. And usually I tell my patients, smoking and diabetes, it's a time bomb. You don't know when it's going to explode. It's a very bad combination, both of them.
Doctor, if your diabetic and high blood pressure is controlled by tablets, and it's controlled perfectly, are you still at high risk or?
Won't be as high, no. If you have risk of history of hypertension, high blood pressure, on medication well treated, your diabetes is well treated, of course you're going to be at risk somehow, but it won't be as
high risk as
That's right.
uncontrolled by
That's right, that's right.
Thank you.
No worries. If you look at the second slide, we look at the same patient who's 55 to 64, non-smoker, cholesterol of 6, good blood pressure, being a diabetic, it's only put you at moderate risk. Before, so he wasn't diabetic, wasn't smoking, he was in low risk. Smoking was straight to high risk. Just being diabetic, not even smoking, it goes to moderate risk. That's why I said diabetes is quite important. And it's very modifiable disease. As I said, by good diet, exercise, you can control it very well, unless it's like type 1 diabetes where you actually born with it or your pancreas is completely gone and then you have no choice with that. Now, if you are diabetic, cholesterol of 6, in your 50s, good blood pressure, but you smoke, close to 20-25%. So it's very, very high risk. Smoking with diabetes, it's very, very bad combination. As I said, it's time bomb. You don't know what's going to explode. You don't know when it's going to explode. I hope that chart will have convinced you to think again if you do smoke. As I said, it's not easy to quit smoking, but at least start thinking about it and try to watch your lifestyle, exercise, improve your diet.
You should have a chart to show the Algeria as well.
Sorry?
You should have a chart to do the
I know, but probably smoking very high that they go high.
Diamond by 200.
Absolutely.
Doctor, what about passive smoking?
Look, it is, but it is not as bad as smoking. Like probably you have to smoke, probably maybe every packet of smoking, it will maybe to 2 or 3 cigarettes, passive
If
smoking.
you are sort of in an environment where everyone around you, or almost like 4 or 5 people around you,
Yeah, but if one, depends how often that happens. See, that doesn't happen every day. But if every day you are living with people, well, tell them to smoke outside. Very simple. Tell them you don't want to die like that.
sure, but what I'm saying is if you happen to be
It's like you are smoking, but not as much as them. And maybe 20%. Yeah, as it's like every cigarette that you inhale from people around you, is equivalent to maybe 3 or 4 cigarettes that you smoke.
or probably they haven't done enough research on passive smoking.
No, we do know passive smoking actually can, depending on the person actually with you, as I said. But if every day somebody smokes a packet next to you, after like a few years, you're going to get something done to your lung, obviously. So, simple steps to healthy diet. As I said, eat healthy, more vegetables, more salads, less fat, less sugar, less salt. Try to walk on a regular basis, exercise, try to come up with a hobby or something that keep you going rather than just sitting behind the couch watching all those Mexican and Spanish musalsalat, whatever. Avoid adding those sugary drinks. Try to get water. Nothing beats water. And choose healthier source of fat. Like nuts are pretty good, but of course, get the raw nut, not the salted and or the cooked nut. And the problem with us, I have Aussie patients that tell me, okay, I have every day 4 pieces of walnut. It's perfect. But the thing is with us Lebanese, we put like nus kilo and then we go for the whole bag. That's no good food. Actually, hot case so basically, having a little bit of nuts, actually, they're pretty good for your heart, good for the good cholesterol as well, especially the walnuts and almond, but not too much of it. And the worst thing also, to try not to gain weight, try not to eat after 6 o'clock. The worst thing is to eat and you go straight to bed, especially having a big meal. So try after 6 o'clock, have a light dinner, and try to go to bed without food after that. And always, any concern, any worries, you always go to your family doctor. Try to do, once you become in your 40s or 50s, try to do blood tests routinely, like every year. Try to do blood tests. They can check your cholesterol, your thyroid, because that can lead to palpitations. They can check your prostate if you're male, and then female, and other tests. So always go to GP, do blood tests on a yearly basis. They can check lots of things. Lots of also people, besides this topic, have vitamin D deficient, and that can lead to lots of neurological problems. So get routine blood tests, and you can take supplements for that. Now, I have a couple of slides that will interest you. I thought stop from talking and just bombard you with.
Just one question, Doctor. Indigestion, should that mimic a heart attack?
Indigestion, if it is indigestion, it's not going with the heart. But sometimes indigestion, if you have lots of acid, can cause a bit of reflux, and it feels like heart attack. I have lots of patients have symptoms typical of indigestion, of heart attack, and it's pure indigestion. So it can go up and can feel like heavy on the chest. And usually they're treated by antacid and so on.
Sorry, Doctor, we have time for a question and answer.
Yeah.
I'll do a small presentation, then we...
But I have actually one patient who came to hospital with indigestion. It was a heart attack.
Can it cause a heart attack?
Indigestion itself, no.
No.
Indigestion just extra acid in the stomach, doesn't cause. But can cause a bit of palpitations if it's bad enough, and can cause feeling that's actually coming from the heart. Now this video, I just have a couple of videos I want to show you. That's interesting, just to show you what we have come to now in the world of cardiology. You've heard of valves being replaced from the groin, because lots of people are quite old these days, because the people are living longer and they're developing lots of diseases. One of the valves, the one I mentioned, the one that 3 and 2, that aortic valve, aortic gets quite calcified and becomes quite severe. But some people, like in the 80s, they have kidney problems. They cannot tolerate open heart surgery for the valve. These people actually have very short prognosis. Within a couple of years, they will die if nothing can be done about it. But these days, thanks to the new advanced technology, it's a very small procedure. They go home the next day, and that valve usually is pretty fixed, and they live 5-7 years without any symptoms. Because people with severe aortic valve calcifications, they have loss of short of breath, loss of chest pain, and they can walk from here to the door. But once we put that valve in, they can walk much longer distances. So just if we show you how it's done, it's quite interesting.
The transcatheter aortic valve replacement procedure is performed on patients who have severe calcified aortic stenosis. And here you see an aortic valve that's not opening well. It's severely calcified and leaflet motion is restricted. So to perform the TAVR or transcatheter procedure, a wire is inserted in the femoral artery. It is threaded up through the aorta and around the aortic arch. And then that wire is passed through the stenotic aortic valve and placed in the left ventricle. Following that, a balloon catheter is passed over the wire into the stenotic aortic valve. The balloon catheter is then inflated, opening up the stenotic valve, cracking the plaque, and freeing up the leaflets. And that's in preparation for the stent valve, or the transcatheter valve, to be inserted. And the first rendition that you see is the first stage of the catheter going in, and then the second stage of the catheter coming through around the aortic arch, over the wire, and it's going to insert into the stenotic valve. Once the catheter is placed in the valve, the stented valve is ballooned open,
With the pressure to crash open that
pushing
calcification.
the diseased leaflets out of the way and leaving a functioning aortic valve in place. And then the wire is removed, and you can see the leaflets of the aortic valve opening and closing, providing normal flow through the valve.
And that stays in the heart, and that's room. So those people without that
TAVR
procedure,
procedure with transcatheter aortic valve replacement is revolutionary in the fact that for the very first time,
so that valve condition, without that procedure, those people actually will die within 6 to 12 months because they're not surgical, not candidate for intervention surgery. Because surgery, like open heart surgery, they have to be on a machine that replaces the heart and so on. So those people, they will be dead. Now actually they're living 5 years, 7 years with no symptoms, and we're improving also quality of life. The next one, another video, but different type of valve. It's actually a leakage valve. So the valve is, rather than closing properly, kind of flail open, and loss of regurgitation, leakage valve. And again, those people without intervention that cannot tolerate surgery, they will actually die with symptoms, short of breath, heart attack, and so on. And now they do what's called mitral clip, as in stapler, if I say, and then actually they'll again go from the groin. It's an interesting one to watch. But not all patients are suitable for the procedure, certain types, especially with this one.
the heart is one of the most important organs in the body, working relentlessly to enable the human cardiovascular system to function. The heart has 4 chambers, the upper right and left atrium, and the lower left and right ventricles. In a healthy heart, blood flows in one direction through the heart's chambers. Delicate tissue-like structures called valves function to ensure unidirectional blood flow within. The heart has 4 such valves, which regulate direction of the blood flow. The mitral valve separates the left atrium from the left ventricle and is made up of 2 thin flexible flaps called leaflets. When freshly oxygenated blood from the lungs returns to the heart, it enters the heart through the left atrium. Left atrium relaxation causes the mitral valve to open, enabling blood to travel into the left ventricle. When the left ventricle contracts, the mitral valve closes to prevent backflow. In some people, the mitral valve doesn't close tightly, causing mitral valve regurgitation. When the heart beats during contraction, the blood from the left ventricle can flow back up to the left atrium. Mitral regurgitation, MR, can be subdivided into functional and degenerative subtypes. Degenerative MR, or primary, results from anatomical abnormalities of the valve itself. In most cases, the chordae connecting the mitral valve to the papillary muscle rupture or elongate, causing leaflet prolapse. MR is a progressive disease which, if left untreated, can initiate a series of events culminating in heart failure and death. Current guidelines recommend surgical mitral valve repair or replacement in severe MR patients. patients for whom surgery is not an option, minimally invasive procedures are available. MitraClip is a unique, highly maneuverable transcatheter system for mitral valve repair. This procedure avoids cardiopulmonary bypass using minimally invasive venous approach.
We have to go from the right or left, have to go through the
And
top chamber of the
transeptal
heart.
puncture to gain access to the left atrium. MitraClip's steerable guide catheter is introduced over a previously placed guide wire. The dilator is used to gradually advance the guide into the left atrium, and the guide wire and dilator removed. The clip delivery system is advanced into the left atrium, positioning the clip above the regurgitant jet and perpendicular to the mitral valve plane. Inside the left atrium, the clip arms are open to 180 degrees and positioned perpendicular to the line of coaptation before crossing into the left ventricle. The clip is advanced into the left ventricle below the valve leaflets and retracted to grasp the leaflets. MitraClip grippers are designed to drop firmly into the clip arms, securely capturing both leaflets. Once the arms are closed, they create a double orifice within the mitral valve. Prior to clip deployment, echocardiographic imaging is used to assess procedural efficiency and leaflet capture. Prior to deployment, the MitraClip can be released and repositioned for optimal MR reduction.
Keep trying till they see there's no more leakage.
Once achieved, the clip is released and the full system retracted. In most cases, the transeptal puncture
All right, any questions?
ترتاح شوي تعبناك كثير الليلة.
يعطيك العافية.
تعبناك الليلة كثير وشرح كثير مفيد ومعلومات قيمة. هلأ سننتقل الآن من قلب الإنسان إلى قلب الوطن. ما فينا ما نحكي عن لبنان. إلى خير رسول للبنان يفاخر بانتمائه لوطن الأرز، مناضل حقيقي انتماءه الوطني ولاءه اللبناني شعاره الأمانة والتفاني. حمل الأرزة في قلبه ووجدانه، صاحب مسيرة مشرفة وطويلة طوتها صفحات مليئة بالوطنية الصادقة والإخلاص لوطنه والشجاعة والعصامية. وقد عمل جاهدا في عدة جمعيات ومؤسسات، ومنها الجامعة اللبنانية الثقافية في العالم التي شغل فيها منصب نائب الرئيس العالمي ورئيس المجلس القاري للجامعة اللبنانية الثقافية لمرتين. تأثر بابن بلدته الفيلسوف العظيم جبران خليل جبران، ومن أجمل مقال: حب الوطن لا يكمن في الهتاف له، وإنما في خدمته والمساهمة في بنائه. المنبر لك الشيخ جو عريضة الرئيس القاري للجامعة اللبنانية الثقافية في العالم لإصدار عنوان.
مساء الخير واهلا وسهلا بالجميع. Doctor, straight away, I'm so glad that you do have a new medicine for broken hearts. So I thank you for that. Ladies and gentlemen, I'm going to be very brief, and I will speak a bit in English, and of course a bit in our Lebanese language. First and foremost, on my personal behalf, and on behalf of the World Lebanese Cultural Union, Geographic Regional Council for Australia and New Zealand, may I welcome each and every one of you here tonight, and thank you, ladies and gentlemen, from the bottom of my heart. You are all most welcome. No words of gratitude can be found to thank someone who has devoted his entire life to help his brother human being. You saw what the technology do and has done and is doing. But with the technology, it takes a special human being with a heart to do and implement these things. Dr. Charbel, no matter what I say to you tonight, no matter what words I try to find, I am humbled in front of your majestic knowledge. And I thank you on behalf of all of us for everything that you are doing to your human being brother and sisters. I also do know that some of you here tonight would not be here tonight if it wasn't for Dr. Ghassan Charbel. Your sign of gratitude, your sign of goodwill, your thank you is all what this gentleman requires. And to know that you are so grateful, it is the best thank you that you can render to someone like him. So on behalf of all of you, thank you, Doctor. Also, through you, Doctor, I would like to acknowledge two very special people here tonight. As I do acknowledge all of you, without exception, and I will not repeat the names because each and every one of you is so special and so dear to us. But two very special people. One that came from a long distance from Melbourne and represent our chapter in Melbourne, Mr. Ghassan Charbel. Thank you for coming all the way from Melbourne to be here with us tonight, and I thank you on behalf of all of us. Also tonight, there is a special dear family. Not long ago, they have lost their father. Their father, their mother, the whole family are all, you have looked after all of them. And to know that today they commemorate the passing away of their father, and it's a very, very special day for them where, you know, the tradition, they sit, they pray, they do all that sort of thing. Once they knew that you are here tonight, they put the tradition aside and they said, no, we will leave the tradition and we will come to say thank you to Dr. Ghassan Charbel for everything he has done. سمعوا على صوتكم دقيقة تيكون ارتاح وبيرجع بيطلع على المنبر وبياخذ كل أسئلتكم أي سؤال اللي بتحبوا تسألوه. طيب دكتور معلش قبل ما بلش بدكم تسمحوا لي احمي راسي اتشكر من كل قلبي باسم الجامعة اللبنانية الثقافية في العالم مجلس القارة أستراليا ونيوزيلندا. اتشكر سيادة المطران باسيليوس يلي سمحنا نكون موجودين عنده الليلة. واكيد يمثلونه هون الليلة بنحب انه توصلوا له عنه معروف كل شكر وتقدير واحترام ومحبة انه سمحنا نكون عنده بهاللقاء الليلة. طيب هلا رح نفوت دغري بالموضوع. بما انه الليلة حديثنا من القلب للقلب، وبما انه نحن من مدرسة واللي منكم بيعرفني بيعرف اي مدرسة علمتنا هي الوفاء والاخلاص، فبقى تسمحوا لي احكي هالكلمتين بوفاء وباخلاص. كيف فيكم تقعدوا على جوجل وتشوفوا جوجل وتتعرفوا على الحكيم، بس الليلة